Hi, my name is Zachary Town, and as part of the health equity curriculum, today we will be discussing misconceptions surrounding vaccinations. At the end of this lesson, you should be able to list some of the common misconceptions surrounding vaccine safety and be able to communicate that to patients. So, one idea that you might hear somewhat often and applied to a whole host of vaccines, or just the idea of vaccination in general, is that you might see the majority of people who have been vaccinated get the disease during a particular outbreak. But in this regard, it's important to look at the rate of disease rather than the total numbers and communicate that to your patients as well. So if we have a vaccine that hypothetically provides 95% protection, um, and that it's given or administered to 10,000 people, that still means 500 people could be infected um, just out of the efficacy rate, not showing that it's particularly safe or unsafe. But if you then compare that to the total number of people who are not vaccinated against the particular disease and ended up getting the disease, you would expect the unvaccinated rate to be higher, even if the total population is lower. So, similar to the efficacy of the vaccine is this idea of hot lots. So, these are lots of vaccines or particular batches that are perceived to be unsafe. This can typically be found by looking up the vaccine adverse event reporting system. And then in there, you'll see that it's a repository or just a collection of any adverse event that occurred surrounding the time of vaccination. So it's a correlation. There's no causation even implied. It's just this event seemed to happen around the vaccination. And so in that regard, you can point out to the patients that they're not necessarily connected by anything other than just the time frame. And if you're looking at particular batches, it's important to remember that not all are the same in size, and so they may take longer to fully distribute, and therefore may have more adverse events in total, but not by rate. And then also some maintain a distribution over time, so that they may be in use over multiple years, and so that the rate of adverse events is not um, suspicious either. So this is a particular one relating to the Tdap vaccines. So ever since they were introduced, there's been this association with sudden infant death syndrome. And in this case, there's actually no proof that Tdap increases the rate of sudden infant death syndrome. In fact, there is some data that suggests it might even decrease the rate. But overall, the assumption is that there's no connection, no correlation. What they've seen is that the proportion of SID deaths are temporally associated with the Tdap vaccination. And what this means is that the peak incident of SIDS happens to occur along the Tdap shot series. So there's 3 shots and they occur over a specific period of time. And during that period of time, we also see SIDS increase. But again, no causal relationship. Another idea, and this is a broader one, is that certain diseases just don't exist anymore. So why do we need to vaccinate against them? We've nearly eliminated measles in the US, and we don't see any polio cases in the US. So why bother vaccinating against them? Well, for two big ideas. And this is what I would recommend bringing up to your patients. One, just because it's not seen in cases doesn't mean it's not present in the environment. And we still have immunocompromised people that need that protection. And so by vaccinating the general population, we're protecting the immunocompromised people. In addition, there could still be community spread through traveling. And so these may be coming from areas across the world where immunization is not as common or is not as thorough. And so they may actually bring the disease into the country. And then if not vaccinated, it would spread through our communities. So this graph is just reported measles cases in the US over time, and everything is reported in the thousands. So what's I think important to point out here is that in 1964 we start to see this very sharp decline, and that's around the year that the measles vaccine was introduced, and so we see that vaccination is clearly working and it dips out. But a common criticism is actually that these rates are already declining, so how can you attribute it to vaccination? Which in this case, you can look at the relationship and see that in the years prior, it was declining, but it was still far more erratic. In that it is clear that the vaccination rate dropped the cases incredibly. And here's just another one with polio. Again, some rates, particularly cases in blue and deaths in red, they were fluctuating. But again, we see the introduction of the vaccine and then a sharp, steady decline as compared to a more fluctuating one without the vaccine. So an idea that's particularly common in parents is this idea of vaccine overload, meaning we're providing too many vaccines at once or in too small of a time frame, and that's putting the child at risk. Into that, we should rely on the fact that studies are done to investigate the effects of giving combinations of vaccines simultaneously, meaning that this is not something that we haven't thought of and investigated. There's two particular committees that give recommendations as to vaccine combinations, those being the Advisory Committee on Immunization Practices and the American Academy of Pediatrics. In addition, obviously all vaccines are FDA approved, and so we have this like double layer of safety information.